Good morning, dear patient, dear friend, dear colleague. Today I want to speak a little bit about vulvodynia. I had already a lecture on vulvodynia, but I'm getting from time to time always more or less the same kind of question about vulvodynia. So I took the decision today to come back to the vulvodynia, to make it really simple and to explain again a little bit what is vulvodynia. Vulvodynia, you see that you will find of some homepage a lot of question and more or less always a kind of same question, and you will always find what is vulvodynia. Is that vulvar vestibulitis? Is vulvodynia an infection of the vulva? So all the question of vulvodynia focus on the pathology of a medical condition, a medical issue from the vulva. So, and then I have to come back to what is vulvodynia. The vulvodynia, the definition of a vulvodynia mean it's not a disease, it's a pain. Vulvodynia mean pain. Vulvo at the vulva, dynia mean pain. So vulvodynia is not a disease, it's a symptom. Vulvodynia is defined as chronic pain or discomfort, tingling, burning, electrical shock around the vulva, mean the external part of the feminine genitalia. The vagina, pain in the vagina, don't belong to vulvodynia. That is another issue. And per definition, vulvodynia don't mean you have burning pain or you have pain in the vulva just since 2 days. Per definition, we said that lasts from 3 months or more. So it's a chronic vulvar pain. And per definition, vulvodynia means without any identifiable cause, such an infection or skin disorder. Mean if you have burning pain, you have pain in the vulva, you go to the gynecologist. For sure, you will get the diagnosis of any infection, any candidose, something like that. Your gynecologist will give some pain treatment, some local topics, some pills, some antibiotic, whatever. And per definition, vulvodynia means despite all this treatment, you have still the pain, no any local treatment or treatment from a pathology of the vulva didn't help. And that is the name of a vulvodynia. So suppose you have an candidose, a mushroom infection of the vulva. It is a mushroom infection of the vulva. It's not per definition a vulvodynia. Now, to understand what it means, vulvodynia, I said, it's a pain. Pain, it's an information that reach your brain. That is pain. If an information of pain don't reach your brain, you are not aware of pain, and then you don't feel pain. It's so simple like that. So, for example, if you need a C-section, you will get an peridural anesthesia or spinal cord anesthesia. So the anesthesiologist will block at the level of the spinal cord the transport of the information it hurts, pain, which normally reach the brain. He will stop this information on the way to the brain at the level of the anesthesia of the spinal cord. And if this information don't reach the brain, you don't feel anything. And vulvodynia is exactly the same. It means you have a pain in your brain which is located at the vulva. That means vulvodynia could be a pathology of the vulva because, of course, you have plenty of small nerve at the vulva, and suppose you have an injury of the vulva or you have an infection of the vulva, the nerve of the vulva, which are located really at the vulva, will capture this information of pain and will bring this information to the brain. That is one option. And for that, of course, you have quite a lot of cause. You have infection, infection of the vulva, bacterial, virus infection, herpes infection, mushroom infection. You can have an irritation of the vulva because of a new soap, because of your underwear, because you're writing too much, something like that. You can have also a pathology of the vulva, indeed, and you can have a cancer of the vulva. So if you have a vulvodynia and nobody found a clear cause by the inspection of the vulva, one should have always to think about pathology like, for example, a lesion of the vulva. And it's strange because over the last few years, how many times I heard from a 25, 30 years old woman, yeah, I have vulvodynia since years, but I don't have a treatment. Nobody can help me because they found out that I have a lichen. And then my question is always, how do you know that it's a lichen of the vulva? Did you get a biopsy? No, no, no. My gynecologist told me it's a lichen. No. If you want to exclude or confirm a pathology, a skin pathology of the vulva, you need a biopsy. So the gynecologists or dermatologists have to make a local anesthesia to take a small piece of the tissue and to bring it under the microscope, and then you will get the diagnosis. Yes, I have really a pathology of the vulva. It could be an herpes, it could be an HPV infection, it could be a lichen, it could be also a cancer. So a 70, 80-year woman who reports that she have always burning pain, irritation of the vulva, you have always to think it could be a cancer. And then you have to confirm or not with a biopsy. So that is one possibility, and that is a possibility in which gynecologists and dermatology are looking for the cause of your vulvar pain. Now, from the neuropelveological point of view, we're thinking a little bit different. Once again, we say that burning pain at the vulva, vulvodynia, is an information that reach the brain. And of course, the nerve that brings this information of pain to the brain on the nerve of the vulva. But from the vulva to the brain is a long way. And if the nerve in between are getting injured or an irritation or something, these nerves are able by themselves to bring the information of pain to the brain. So suppose you have an endometriosis of the nerve of the vulva within the pelvic cavity. The nerve will bring the information to your brain. I am the nerve of the vulva, and I tell you that I have pain. And the nerve will not bring the information to your brain. What is the cause and where is the information of pain is started? Is the information start from the vulva or start in between the vulva and the brain? Your pain will be the same. The brain will get the information, I have pain in the vulva. And from the neuropelveological point of view, that is the key. Because per definition, once again, vulvodynia means you have no cause of the vulva. So in neuropelveology, we said, also the cause is not of the vulva, but of the nerve of the vulva, somewhere between the vulva and the brain. And that will be the key in the diagnosis in neuropelveology. First, to find out where on the way to the brain there is the information of pain is created in the pelvis or in the central nerve system, like in the spinal cord, or even in your brain. And the second in neuropelveology will be to find out the nerve brings the information of pain because there is a damage of the nerve or an irritation of the nerve, and the treatment is definitively not the same. So you will have endometriosis. Endometriosis of some pelvic nerve may induce vulvodynia, but usually not alone. Endometriosis of the pelvic nerve usually combine vulvodynia, with eventual perianal pain, with coccygeal pain, with low abdominal pain, and mostly also some dysfunction with the bladder, what we call pollakiuria. You have to go very often on the toilet, and depending from the nerve, even pain in the back, in the bottom, or in some patient, even pain down to the legs. And the combination of the different pain, the different symptoms, will help the neuropelveologist to find where is the exact location of the irritation of the, or the lesion of the nerve. Now, you can have an irritation, an injury of the nerve, for example, due to a previous surgery. If you got a previous surgery for cancer, for endometriosis, whatever, or implantation of a mesh for prolapse surgery, maybe your surgery will induce an irritation of the pelvic nerve due to scar tissue formation close to the nerve, or maybe the surgeon made a mistake and used an injury of the nerve. Then we have two possibilities. One is what we call non-neurogenic, mean you have an irritation of the nerve, and the treatment is to block the nerve or to release surgically the nerve. On the other side, you have a lesion of the nerve, a cutting of the nerve. Then it makes no sense to make a nerve release. Then you have the option of blockade of the nerve, eventually with Botox, depending from the location of the lesion, or you have what we call neuromodulation. You bring electricity on the nerve to cover the information of the pain on the way to the brain. Some tumor, and probably the most frequent cause for vulvodynia is probably vascular entrapment. Vascular entrapment means irritation, compression of soft nerve by atypical and or enlarged vessel. And then it's typical that this patient will report about pain not during intercourse, like it is always the case in vulvodynia, but also after the intercourse. The first 30 minutes to 2 hours after the intercourse. And very often the pain decreases overnight, and the patient has the best time of a day in the morning after waking up from the night. So coming back to some of the question, you have some question of patient who asked, all you need to know about how long does vulvodynia flare up? Or another question, how long do vulvodynia flare-ups last? So when I see a little bit the answer on the different homepage, I will find answer which are typically linked to a vulvar cause. But the nerve cause, somewhere between the vulva and the brain, this aspect of vulvodynia is completely ignored in the literature. So we are taking, of course, intercourse, tie closing, cycling will increase the pain because you will induce a further irritation of the nerve. But it don't mean that the cause is at the vulva. So you can find a lot of, now I will be a little bit impolite, but you will find a lot of blah, blah, blah about the vulvodynia. And most of the patients we experience always the same. They try to follow all these recommendations to use this topic, lidocaine, whatever. And at the end of the story, they will sit down home with the same pain. Why? Because the key in medicine is not to treat, but to have the right diagnosis. If you know exactly why the patient has pain, then you will find the right treatment, the adapted treatment to the condition of the patient. But suppose you have a lesion of the pelvic nerve and you try to make a laser vaporization of the vulva, or even to perform a surgery and to say, wow, your problem is an infection of the vulva, what we call vestibulitis. And you will say, wow, the best treatment, you have pain in the vulva, let's remove the vulva. And how many patients I saw in my career, they came with vulvodynia and they had in previous surgery a removal, surgical resection of the vulva, what we call a vulvectomy. And my reaction is always the same. I always say, oh, I'm happy that you are not suffering from headache. Because if you go to a doctor specialized in headache and your treatment principle based on where you have pain, you have to remove, with headache is a little bit difficult to treat. So once again, in vulvodynia and most of the uh, refractory or intractile pelvic pain and no genesis, that means you don't know why the patient has pain. The key is not to try one treatment the next, but to have the right diagnosis. So, and that is one of the questions, what caused vulvodynia to flare up? No, the cause is what the question is, what is the cause of the vulvodynia? And then if you think about, one question will be at the vulva or at the level of the nerve of the vulva, and then it will be in which level, if it's a nerve, in the pelvis or in the central nervous system. And the third question, it will be non-neurogenic or neurogenic. And all these questions need an answer to find the right adapted treatment for each patient. You cannot say, oh, I had a patient, she did that, she have no pain, so I will use the same treatment for all of the patient of my praxis, of my consultation. No, the treatment have to be adapted to each patient. So one question is always lidocaine. If it's help to bring lidocaine on the vulva, yes, if the cause is at the vulva. But if the cause is higher than the vulva, in the pelvis or even in the spinal cord or in the brain, then lidocaine in local application will definitely not work. It's so simple like that. And if it don't work, it's too easy to say, okay, this patient is crazy, she has pain in her brain. No, it's because the treatment was not adapted of the cause. If the cause is in the pelvis, you cannot advise a local treatment of the vulva. It will not help. It's so simple like that. So how I cure my vulvodynia, that is exactly the same. There is no solution out of the blue. Cure my vulvodynia means help me to find the right diagnosis, the cause of my vulvodynia, the cause of my vulva pain, at the level of the vulva. And of course, you will have to go to a gynecologist or a dermatologist. But if both said we don't find a cause for your pain, then remember it could be the nerve of the vulva. And then for such kind of diagnosis, clear, you need a neuropelveologist. So once again, the cause is the key. In neuropelveology, in all this kind of pain, if we are talking from vulvodynia, prostadynia, that means men with prostate pain, where usually the urologist say, oh, you're affected by a chronic prostatitis, and they are giving antibiotic over months. Or you have a chronic pain with a vulva, then somebody will tell you, oh, you have a chronic infection of the bladder. They will give you antibiotic over months, and the situation will get worse and worse. And some point you will get the diagnosis. Probably you are affected by interstitial cystitis. No, that is definitely not the way. If you have a pain, once again, pain is an information that brings that reads pain is an information that reaches your brain. So the key in the treatment of pain is to find out the cause, or of course there is another solution, is to treat the symptom with pain medication, with a lot of central medication, pregabalin and all these things. But all these painkillers will not treat the cause of your pain. That means probably you will have to take such kind of medication for the rest of your life. And then over time, you will develop accoutrements of this medication. So from time to time, you will have to increase the dose, and you will get more and more side effect over time. And that means at some point, you will come in isolation, private, social, and at your work. And it's much too easy and to jump then, oh, you have vulvodynia, nobody can help you, we didn't find any solution, so probably the main cause is your brain, you're crazy, or you had any sexual disorder in your brain. No, that is not that is definitely too easy. In neuropelveology, you have to find the cause, and for that, you need definitively a neuropelveologic examination and patient history. And that is not a question you can solve in 5 minutes or even 15 minutes in a gynecologic consultation. You need 1.5 to 2 hours for that. So then, of course, in pain, you have also to think about pain memory. Because when a patient is coming with a lot of vulvar pain, she has no intercourse that's destroyed more or less her partnership. Her husband is bored by the situation. The whole family don't hear anymore about my pain, my pain, my pain. At some point, you will develop what we call a central sensitization. So in neuropelveology, we have always to treat the cause of the vulvodynia, but also the consequence of the vulvodynia, which is the central sensitization. So once again, not only in situation of vulvodynia, but in all pelvic pain where you don't find a cause, the proper treatment, and no treatment does help, then the key is to come back to the diagnosis. And not just the diagnosis, you have pain, but what we call the etiological diagnosis. So that means to find the cause of your pain. That is the key. And I thank you very much once again for your attention. Have a good day. Bye-bye.